I met Bryce on the first day of his life, and he is a delightful child. He was a normal baby. Everything appeared entirely normal. The only problem was he just wouldn't feed right.
He would want to eat for about 2 minutes and then he would fall asleep, and so we really had some difficult times nursing. They actually ended up taking him to the NICU there at Shannon because they couldn't get him to eat and they wanted to monitor him.
Everything else was still looked okay on Bryce. Everything seemed fine. He otherwise was a normal child. There's a few things that then I began to look at what would make us not feed well. You could have infection. We had checked that out. There wasn't any sign of infection. One of the things that might do it is if you had a cardiac or heart problem. But we went ahead and did the test just to make sure.
And that's when he noticed the heart murmur. And that's
it was amazing that he heard it too. I mean, every doctor that we spoke to in San Antonio, cardiologist, nurse, nobody could hear it. And they said, you know, it's amazing that he heard what he did, because if we would have came home, that Bryce probably wouldn't have made it.
Yeah. Matter of fact, Dr. Porsche said that she had to listen on three separate times just to hear the murmur. And I think her words were, we needed to hug him and thank him because he saved Bryce's life.
The wheels got set into motion, and we talked to the specialist in San Antonio.
It just happened so fast. It's just hard to focus because you're still in denial. You know, you just flew in a plane from San Angelo, in a jet, from San Angelo to San Antonio. And I mean, you only see this stuff in the movies.
They actually had to stop Bryce's breathing in order to get perfect pictures of his heart. And they told us at that point, they sat down in a conference room and explained to Tony, myself, and my mom that he had Schoen's complex.
One of the pumping chambers, the main pumping chambers, was way too small. He had some of the valves, one of the valves didn't close correctly. He had some blockages up higher in his big arteries.
So at that point, they were actually considering a complete heart transplant, and he explained to us the problem with that is, you know, it has to happen in California is where he would suggest that it happen, and that, you know, about 50% of babies don't ever make it to get a heart. And well, we were like, well, then that's totally not an option for us.
We're talking having to decide, do we just do a little operation or do we do a transplant? If we do this little operation, it may fail and it may be too late to do the transplant. I mean, we're talking a heart-rending decision that you have to make as a parent.
They always tell you that there's going to be long-term effects, and for us, I mean, I know I keep thinking that this surgery right here will tell us kind of his long-term, you know, I guess, life.
The valve that's not working well, they're going to try to fix that valve. It will probably be about the day we have the telethon. So maybe right now Bryce is getting that heart fixed, or he'll have just had it done or getting ready to have it done. But he will, at that time, once they get that fixed, then they will be doing some other things to rearrange the plumbing to get the blood flowing in the way it needs to be, and he'll be almost back to being, or almost having a normal heart and living a totally normal life.
You know, when we were at Shannon, and they made mention about the incubator that Bryce was in, and I remember looking at the little plaque on the side at Children's Miracle Network, and it didn't dawn on me. I had no clue who they were, and you know, now, you know, that was a particular piece of equipment that Bryce had a place to go that helped prolong his life until we could get him to San Antonio.
There's still a chance that he'll need valve transplant down the road even if they do repair this valve, but they're hoping to at least get him to be 13 to 15 years old.
Bryce is a miracle kid because he's going to be a survivor. He's going to live to tell a story and his experiences. People are going to ask questions, and he's going to tell us whole story and shock everybody and give anybody that has any doubt faith again.